Welcome to Digital Health Talks, where innovators and changemakers share how they're transforming healthcare through technology. Join Megan Antonelli, who will be shining a light on the good things happening in digital health.
When the EHR goes down, the clock does not stop for patients. Clinicians lose the chart, the meds, the allergies, and they keep delivering care anyway in the dark. Most health systems still file that under IT. My guest argues it belongs under patient safety. This is Megan Antonelli, CEO of Health Impact Live, and this is our Female Founder series on Digital Health Talks. Chao Cheng Shorland is the co-founder and CEO of ShelterZoom. She came up as an enterprise architect before deciding the hardest problems are the ones nobody plans for. Let's get into it. Hi, Chao. How are you today?
Hi, Megan. Yeah, very good. Thank you so much for inviting me onto your show.
Absolutely. Well, I'm so excited to talk to you. Reading about your background, really intrigued me in terms of how you got to healthcare. So tell us a little bit about, your story and what you did before ShelterZoom.
Yeah, so before I moved to the States and started ShelterZoom, I lived in Australia and worked for a lot of large organizations as a chief architect and enterprise architect. So what happened was from the financial services to the manufacturing, supply chain and to oil gas. And every time you kind of work on these major programs, you always feel, wow, there's just so much you can do with the content, with the data, with documents. So I remember back in 2010, I took on a very major program as a chief architect to design and deliver a end-to-end solution for a $40 billion program, which is a joint venture between ConocoPhillips and Orange Energy. And because they just got the license to do the coal seam gas, liquefied gas, and export to Asian market and the international market. And when I went on the program, wow, this is like the massive amount of data and the documents and the supply chain moving across all the materials. So I saw just a lot of downsides of the existing technology. And I was thinking one day I should really contribute my ideas and making the world a better place. So then the opportunity came 2017 when I met with my co-founder, who's New York based. And then we actually had a very similar vision. And I thought, wow, I've done so much in the corporate world. I don't really want to become a CIO or the further anymore. I just want to kind of to do my own startup. So that's how I started the ShelterZoom.
Oh, that's amazing. And so ShelterZoom started outside of healthcare in kind of in the oil and the finance side. And then you saw, a need within healthcare. And I imagine, we talk a lot about, or for years we talked about how much healthcare was sort of behind finance, behind, industries that had so much money. Frankly, that's in some ways the difference, right? Is that they've had a lot of money to be able to invest and a lot of reason to do that. And there isn't quite, maybe the complexity, I suppose, those sitting on a oil field might argue with me, but tell us a little bit about, what convinced you and what you saw in healthcare that you could bring this to.
Yeah. So, ShelterZoom, actually, when we first started, it was a content management, security, and data ownership company. So 2018, we invented the world's very first document token, and we immediately thought about healthcare, the applicability, right? You can actually tokenize medical records. So once you tokenize, now patients or the owning hospitals can own those documents, really control the digital rights. And it's really a great use case. So we were so excited to bring that to the hospital when we developed the document GPS platform. And then hospitals look at this, said, gee, this is really innovative, but that's not our top priority. I said, what's your top priority? He said, our top priority is a pen and paper during downtime. How can we get rid of that? So first time I heard, I was thinking, wow, is that the healthcare big challenge? They said, this is the biggest challenge ever since we had a EHR, because now the students from the universities, they don't even learn paper charting anymore. They just assumed everything is electronic. So now during downtime, not many doctors even know, or nurses even know how to do the paper charting. It's becoming really bad, and especially for patient safety. So I then went to many hospitals to validate and making sure I was not kind of like hearing just one side of story. After probably, I would say a dozen major hospital systems, and everyone told me the same story, I concluded, wow, this is a major problem. And now I'm aware of this, I really should actually help fix. So, out of all this, a little bit naivety, didn't know how challenging this is. And I took on this, really the challenge. And 3.5 years later, I'm just so grateful for all these hospitals told me this problem. And we are really on the way to eliminate pen and paper during downtime.
Yeah, that's amazing. Well, I know, I think I heard it recently, and I've heard it a number of times, but another female founder, Judy Faulkner, has said, that the medical EHR record is as complicated as, rocket science. And I think, the taking it into, sort of the simplification and the work that you're doing with it is no easy feat. And it always, everything looks a little bit simpler, at the beginning, and then the complexity is there for sure. And I think, you're describing a problem. We talk a lot about The show, The Pit on.
That's right.
Yeah. And they literally, had this happen where we saw, them rolling in fax machines and calling people who, no longer worked in the ER to help them during that downtime. So I think, both the CIOs of the hospitals and as well as lay people kind of are now understanding that this problem, but, and talking about it really not just in the frame of, what gets missed and what doesn't, but it really is a patient safety problem. So tell us a little bit about, how you've approached it at ShelterZoom and what that looks like.
Yeah. So from day one, and what I saw is a problem directly impact on patient care, and that right at the beginning. So if you look at the traditional kind of approach, right, it's about disaster recovery. But disaster recovery is after failure. You have to wait for IT to restore, to be able to get a backup going or whatever the method. So you're already missing that whole period. You're not able to properly take care of your patients. And our design principle is it just cannot impact on frontline workers. So the care delivery cannot stop. So healthcare shouldn't stop. So that's really the design principle and the invention of our method. And then we actually received the USPTO granted patent. SpareTire is the very first system didn't impact on frontline workers. So the whole concept can extend from physicians, support workers, but obviously airline and all others. But our focus is really the EHR downtime, the healthcare side. So that's really the major difference between SpareTire and the disaster recovery. So we really focus on continuity during failure, not disaster recovery after failure.
Got it. And for our audience, tell us, the SpareTire is the name of the product, right?
Yes, that's right. So we just thought it's so appropriate because we're not trying to build a spare car or a massive kind of something, because we understand it's a lot of clinical workflow, but we build as a very lightweight and a light data, high performance, even under very limited network connectivity, you can function. So just like the spare tire in your car, you always want to carry a spare tire in case something happens, because anything can happen. And you immediately put a spare tire, get you to the next the safety spot. Then you can replace by the main tire again. But what's interesting is spare tire, anything you captured during downtime inside your spare tire will be automatically sync back into your primary system. So in that way, you do not have to spend 4 times, 7 times longer to do the double manual data entry.
Right. I love that. I don't know. I speak another analogy or image that I remember seeing very early as we were, kind of doing, content and events and interviewing folks about healthcare. It was the CIOs changing the tires while the car is moving, right? So as we were when we were talking about EHR implementation, that was, and I love an analogy, and sometimes I beat them to death, and I, certainly use that one over and over again, but it's a great one. And certainly coming up with that, I think must speak really to those, leaders who have been, really, sort of driving that car and changing the tires for years. So I love it. Now, I think that the piece around what you said, which is recovery, is where we tend to focus, right? And not thinking as much about what happens to the care in those hours. And so, tell me a little bit about, how people have sort of gotten that wrong in the past and what Spare Tire does to change that.
Yeah. So at the moment, if you don't have spare time, everything's downtime procedure is pen and paper. And recently I spoke with a CIO at one of the top AMCs. And he said to me, when my team come to say, doctor, I'd like to show you our downtime procedure. He said, oh, you're talking about pen and paper, right? I said, you don't need to use the term downtime procedure. Sounds very fancy, but really you're just talking about paper charting. How can I do the paper charting? So he had a bit of laugh, but it's actually the reality, which is very, very sad. So hospitals all have the manual, the downtime procedure, and then some actually do have a read-only access to certain type of solutions, but they can't really do any more, like a workflow or do the notes, do the orders, do the medication. They just completely stop at that point. Then after that's all pen paper. So this actually caused such a problem, especially in the acute care. When you actually need to order medication, lab or radiology, you use paper runners. In the hospital during downtime, you will see tens or hundreds paper runners running across building from building, floor to floor, because they have to deliver in the paper, right? The paper format. So the problem is after 24 hours, literally even paper collapse because the paper piles up like the whole floor, and it's just paper, you can't move anymore. And the people cannot move fast enough, and they don't have proper fax because a lot of times communication got cut off as well. You can't really send the urgent order, like a medication order, to the pharmacy to get the medication back. So this really impact on patient safety, and everything gets delayed, and a lot of procedures get canceled. So at the end of the day, truly patient safety is the biggest concern. And then the mortality rate, and from some recent research during downtime, is actually increased by 20%, sometimes even 50%. Wow. So now with the ransom attack happening, and downtime on average 24 days now, it's not 2 hours, 24 days on average. So you really have so much paper to move, and it's completely not manageable.
Mm-hmm. Yeah. I mean, I think the threats, we hear about them so often and so frequently within the, within the hospitals, and then where they get hit and how they respond in terms of, providing this to health systems. And you talk about this a bit in terms of like the reactive recovery versus proactive resilience. And so when you're talking to your customers right now, how are you explaining what that shift looks like in terms of, kind of planning around restoring the systems and what that sort of mindset looks like?
You're listening to Digital Health Talks. When we return, we'll continue our discussion on how technology is revolutionizing healthcare delivery. Stay with us to hear more insights on creating sustainable, patient-centered digital health solutions.
I actually think the hospital system themselves, the awareness has really increased so much, because I remember 2 years ago when I was actually explaining to people about spare time, everyone could see it's so important. But some hospitals will say, oh, we can get by this, by that, because they don't really understand that this is not just a backup system. It's really just in time, immediately get going. So now, because of the cyber attacks, AI driven kind of cyber attacks, and then plus ransom, I think the hospital, the awareness is really like overnight. It's just everyone realized, wow, defense itself no longer enough. You have to have resiliency. resiliency is really the game. So that's really increased that kind of the desire to adopt this type of solutions.
Mm-hmm.
So I think it's just the maturity level has really increased a lot. And then also a lot of decision makers now really thinking about, hey, if my hospital goes down, that is a huge amount of liability. So they just couldn't afford needing a solution like this. Yeah.
Yeah, no, I think the mindset has changed, and the nature of the threats have changed as well. I mean, in terms of, kind of AI, and not that it hasn't been there before, but it's moving fast. Adoption is moving fast, and the threats from that are coming into play. What are you seeing, and how are you kind of reacting to how, leaders should kind of balance on, the AI coming and kind of protecting the patient data, keeping the trust intact, and as you said, kind of that focus on patient safety?
Yeah, so AI really arrived so fast. Super fast, and then but the trust really hasn't. So every hospital is trying to figure out how they actually really implement the proper enterprise like AI. And we have actually engaged with a lot of hospitals, and they are at the beginning of their journey rather than they already figured out how to do that. So they're building a lot of foundations. So one of the pieces really missing is the trust, the governance. That AI actually, in my mind, should be self-governed. You can't govern AI. There's just millions, AI can create within a day. How can you govern them? So AI needs to really have the inbuilt governance vehicle, right? Govern themselves. So interestingly, you actually say that because we are about to launch a new platform called Mithra AI. It's actually blockchain-based, the cryptographic-based, and to insert into LLM or other kind of the content management and ensuring every decision, there is a source, there is a trusted source, and you can actually audit a few months later, hey, where's my decision come from? Where did the data go? Who has viewed? Who has actually done something to it? So you have a total data lineage across your whole AI workflow. So we're also very excited to add that into the spare time, into the whole, the hospital and the life science kind of ecosystem.
Oh, amazing. Now, explain to me a little bit. Let's go back to spare tire. I mean, what does it look like? If it's not pen and paper, what is it? What are the health systems sort of implementing when they're implementing it?
Yeah. So the spare tire really comes with two modules. So the first module is the end user, right? Physician or the user experience. So when they come in, it literally just caters for all your essential workflow from the paper chart. Not paper chart. From the chart, your chart overview to taking clinical notes, do the vital sign reading, do your the diagnosis, and then also the orders, medication order, the lab, radiology, MA, and then results. So all the essential workflows are there. So it really, I can't say it replaces 100% paper, but it's really a large percentage of paper. We also have the best status management. So you can actually really check where are the empty beds. You can quickly move the patients in. So obviously the ADT part, the admission, discharge and transfers all covered as well. Then we are actually releasing an ED tracking board. So like you said, the PID show, hey, when the ED tracking board goes down, you don't know what's happening in your emergency department. That's actually very dangerous. So we're actually releasing that as just a board you can actually keep running. And even your primary board goes down, you still have a backup spare tire board, to really triage a patient and do other things. So on the other side of the fence is the administration board. So that's really where you can actually set up your hospital facilities. You can import your facilities from your primary system into here, and then all your provider details. Then you can actually manage your HL7 integration. So integration is very simple because it's all templated. Everything's configurable. So you just need to say, hey, I need this workflow, and then all the default and also the role-based access, everything coming in the package. So the most amazing thing about SpareTie is we designed it in a way it's so simple. There's no user training required. So literally, we actually had a lot of doctors, ED nurses kind of use the system. They actually found out there's no zero training required. They all figured out so fast, and it's just so easy to use. The reason we did that is actually really intentional because it's not a system you use all the time. It's not like your regular EHR or your normal corporate system, right? This is your downtime. It's only when you need your downtime, you activate that. Now you can use it. You don't expect anyone will learn, have even the time to learn. So the system has to be so intuitive. And I'm just really glad we actually achieved that.
Yeah, that's amazing. So does it sort of live within your system during normal times and then get activated when a threat comes in and you have to go to downtime? How does the shift, what does the shift look like? And forgive me if I'm coming at this from a layperson's perspective, but I am.
Oh, no problem. So SpareTie is always in the passive mode when your primary system is running. So it's read only. You cannot actually write anything because we want to make sure primary EHR is your master system. So it does get a subset of data gets synced in real time through HL7. Then as soon as your the primary system goes down, you can immediately activate SpareTie. Now all the doctors, nurses, they can now divert into SpareTie. They will have an icon on their device or anywhere they actually need that access. So they can just click on the icon, go into the SpareTie, and then now at that point of time, they can actually start doing all the normal workflow charting, vital sign, everything. Yeah, they can make a medication order. So then after the downtime, after downtime's over, and it will actually turn back into the passive mode at that point of time, and they will be prompted by the sign, say, hey, do you want to sync the data now? So then they can actually confirm and sync all the data. So then we will produce the reconciliation report and then making sure all the data gone back to the primary system safely.
Amazing. So, and one more technical question, and then we'll move on.
No problem.
My brain starts to hurt now. But in terms of EHR agnostic, what does it work with? Epic, Oracle, everything?
Yes, that's right. And as long as you have HL7, literally all EHR systems now do, and you can actually use SpareTie. So we have the bi-directional HL7 engine is a proprietary. We build ourselves because to overcome the volume and the speed problem of the standard, engine. So it's very high speed. And now you can connect with, doesn't matter, it's Oracle, Epic, Meditech, Athena, or Scoop. Any system can use SpareTie. And just like the car, you really should have a SpareTie for your car. Doesn't matter it's your Toyota or it's a Mercedes-Benz.
Right.
You should all have one.
Yeah, absolutely. That's great. Amazing. Well, excited to hear about, kind of the implementations. I know you're in pilots with a number of different hospitals and being implemented. So excited to hear how it develops. And I think as we, the Female Founders Series, so to talk a little bit about, you worked in oil, energy. I did events many years ago in that space. I think I was always the only woman in the room. I'm sure it's changed now, but back then, and then of course, finance, and now, healthcare is probably a little bit of a refreshing, compared to those two industries in terms of diversity, but kind of leading a company in this space. Tell us, what you would share with other female entrepreneurs and leaders, about that experience.
Yeah, I actually found it's extremely rewarding. So when I first went into healthcare, I understood the scope. It's just so big, right? And just a lot of kind of paths to navigate, and the systems are very different from other industries. It's just very kind of how I describe, really very concentrated, and then everyone has their playbook. And what's really interesting is once actually you know a group of people and you found that actually healthcare very small in terms of stakeholders. It's a community so tight. Like everyone knows each other. You go to HIMSS, you go to, other conferences. Hey, you just like feel like it's a reunion. And that part I actually didn't find in other industries. I found that actually healthcare is almost like a very family oriented, large industry, but yet actually it's just so personal. So I actually really enjoy actually last 3.5 years, just so dedicating healthcare. And we do a bit of life sciences as well. And because I'm always very fascinated by healthcare and the life sciences, I just had a lot of curiosity. And I actually thought, at the beginning of 2023, when I became aware of this problem, I was thinking, gee, this is really amazing opportunity for me to get so involved in healthcare, right? And because the interoperability problem, a lot of other things I can really help resolve along the way as well. So yeah, I think really grateful for the healthcare, especially in the US. For me, it's coming from Australia, it's a very different culture, but I'm able to really navigate and now having a very strong and a market fit product, offering to the healthcare, really helping them to be resilient.
Yeah, I love that. I mean, I felt that as well. And that's, I was always a healthcare person, but when I would do, the occasional finance or energy event, it was always like, I want to go back to my people. And it was, especially in convening and bringing people together, that, I think healthcare has such a collaborative take and perspective that they want to work together, but they also have sort of, this academic problem solving learning that kind of helps with that, as you said, sort of family community environment that people, are all coming together to tackle these problems. And you've been working on, a problem that is a real challenge for people. And when you do have that solution, you'll easily find your home and be embraced.
And the people do embrace. They actually, so many people said to me, Chao, you don't need to sell your solution sells itself, because everyone understands the problem. And it's just so, encouraging to hear things like that. We don't find that in other industries, to be honest. It feels like you always have to kind of like think about, how do I position myself? What's my GTM? And then this one, and to be honest, I kind of never actually reviewed in any of the shows. And we literally just had three people selling spare time. Not even selling; it's more like a consulting, help people understand, the solution. And we covered, double-digit percentage of acute care market within 10 months. It's really extraordinary.
Yeah, no, amazing. Well, really a pleasure talking to you and getting to know you and the product, Spare Tire and Shelter Zoom. And I hope our audience, finds it and gets it running to prepare their health systems as well.
Yeah, thank you so much, Megan. It's such an honor talking to you, and I really enjoyed the conversation.
Absolutely, Chao. Look forward to seeing you in the future at a HIMSS or Health Impact soon. And to our audience, if this conversation got you thinking, that's the whole point. That is why we're here. Share it with someone who needs to hear it. Subscribe to Digital Health Talks and follow us on YouTube. This is Megan Antonelli, CEO of Health Impact, and this is Digital Health Talks. Let's keep fixing healthcare one conversation at a time.
Thank you for joining us on Digital Health Talks with hosts Megan Antonelli, Janae Sharp, and Shaheen Shah. For more insights on healthcare innovation and a deeper dive into today's discussion, visit healthimpactlive.com. Join us next week as we continue exploring the technologies and strategies transforming healthcare.